live.
Okay, I can hear you.
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. And first of all, Ramzan Mubarak. At last, the long-awaited month of blessings is here, and may Allah Ta'ala heal our world, strengthen our hearts and our minds in the midst of all this turmoil, giving us hope and peace. Ameen. Today, we are honored to have with us our San Antonio community member, Dr. Quratulain Kizilbash. She is a medical director at Texas Center for Infectious Disease in San Antonio, Texas. She's also a medical consultant for Heartland National TB Center and an associate professor in internal medicine at UT Health Northside. She's here to explain how we can help flatten the curve for COVID-19 and what we can do in our San Antonio specifically area. She will also be answering any questions that you might have about the topic. So without further ado, over to you, Dr. Kizilbash.
Okay. Okay. All right, so can everyone hear me okay? All right. Okay, I apologize. What's going on? Okay, so Assalamu alaikum and Bismillah ar-Rahman ar-Rahim. Firstly, I wanted to thank Zainabia Islamic Education Center for inviting me to talk about COVID-19. I'm especially going to be focusing on Texas updates over the last few weeks. And, you know, I wanted to begin with an ayah from the Holy Quran. And as you know, this is the month of the Quran. So I wanted to start with this. And this is an ayah from Surah Yunus, and it can be roughly translated as, O mankind, there has come to you instruction from your Lord and healing for what is in the hearts and guidance and mercy for the believers. And as we know, reading the Quran not only has spiritual and emotional benefits, but it also has physical benefits for cure from illnesses. Okay, so as we know, we are currently in the midst of a COVID-19 pandemic, but it's important to keep things in perspective. So we know that humans have been infected with various infectious diseases since we first walked the earth. And some of these diseases have been far more deadly than COVID-19 has, such as malaria and tuberculosis and the bubonic plague, as well as cholera. Only time is going to tell what impact this pandemic is going to have globally. But one thing is pretty much for sure, that this is not going to be our last pandemic. Okay, so first of all, a brief introduction to coronaviruses. So the virus which causes the disease, coronavirus disease 2019, also called in short COVID-19, is called SARS-CoV-2. This is an RNA virus, and it is not the same as the coronaviruses which commonly circulate among humans and cause about 25% of common colds. SARS-CoV-2 is similar to SARS-CoV, which is the virus that caused the SARS outbreak in 2002. And it's also structurally similar to MERS-CoV, which causes the disease Middle Eastern Respiratory Syndrome. Coronaviruses are found in both animals as well as humans, and bats are one of their natural animal reservoirs. We know that somewhere towards the end of November to early December 2019 in Wuhan, China, SARS-CoV-2 spread from bats via an intermediate host, which were probably pangolins, to humans. And you can see a picture of a cute little baby pangolin on the right. And the scales of these pangolins are considered to be very important in traditional Chinese medicine, and they use these medicines made from the scales to treat a variety of illnesses. So since that time, as we all know, over the last few months, COVID-19 has spread, worldwide. And this data is as of yesterday from the COVID-19 dashboard at Johns Hopkins University. And you can see that we are approaching almost 3 million confirmed cases globally. And topping in terms of the number of confirmed cases is the US, where we are approaching about 900,000 confirmed cases of COVID-19. And the actual numbers are probably much higher than this. These are only confirmed cases. In terms of total deaths globally, we are approaching 200,000 deaths at this time. Okay, so looking at the US in a little more detail, you can see that the number of cases of COVID-19 which are being reported to the CDC is actually rising still. You can see that the curve, though, overall is not rising as exponentially as it was in the towards the end of March and early April. So actually that is a little encouraging that the measures which are currently in place are actually working to some degree, right? So the number of cases is slowing on a daily basis. Okay, we know that not all states are reporting equal numbers of COVID-19 cases. So some states have been affected more so than others, especially New York, some other northeastern states, Florida, California, Louisiana, and then our state of Texas, where we are. Okay, zooming in on Texas, you can see that as of yesterday, the number of confirmed cases which have been reported are almost 23,000. And the number of fatalities have been almost 600 in Texas alone. About 4/5 of all the counties have been affected in Texas, and topping the number of cases is Harris County and Dallas County. And Bexar County is actually coming in 5th in terms of the number of cases at this time. Okay, when we look at the number of daily new cases for Texas, you can see that this is still a pretty significant number. So as of yesterday, in Texas alone, there were 862 new cases of disease that occurred. The highest number of new cases of COVID-19 in Texas was 1,441, and this occurred on April 10th. But since then, I mean, there's still a sizable number of cases occurring on a daily basis. When you look at zooming in on Bexar County, where we currently are, there still are about 40 to 50 new cases diagnosed on a daily basis. And this gray bar over here represents the cumulative number of cases that have occurred in Bexar County. So every day we're seeing 40 to 50 new cases. This was just as of yesterday. I put this there that the mayor was giving his update on COVID cases, and there were 28 reported as of yesterday. In Bexar County, there have been so far 43 deaths from this illness. Okay, we are doing better though, I would say, in terms of our hospital situation. So, as we know, there was a concern a few weeks ago that will we have enough ventilators available? Will there be enough ICU beds and hospital beds? And right now, this is as of this morning, you can see that we still have over 2,000 ICU beds available, hospital beds over 20,000, and there are about 6,000 ventilators available in Texas. Okay, so it's important to know how the disease spreads. So this virus, SARS-CoV-2, is thought to spread mainly from person to person through respiratory droplets, which are produced when an infected person coughs, sneezes, or talks. And you can see here on the right, this gentleman is sneezing and he is producing a big cloud of droplets, which can contain, if he was infected, there would be virus particles in all of these droplets, right? So this is most likely to spread between people who are in close contact to one another. So within about 6 feet of each other is the highest risk. Most of the droplets will actually go and drop within a few feet of the patient, but the smaller ones can go up to 6 feet away. These droplets, if a person was standing close enough, can go and land in the mouths, noses, or eyes of those who are nearby. And there also are certain situations in which these virus particles can become airborne. That means they can actually float in the air and they can remain in the air for hours, and they can actually be inhaled into the lungs. So when the person standing, nearby would take a breath in, they could actually get inhaled into the lungs that way. The scary thing is that COVID-19 can also be spread by people who are not showing any symptoms of the disease. That means they are asymptomatic. And so they wouldn't even know they have the illness, but they could still spread it to other people. The best way to prevent illness is to avoid being exposed to the virus in the first place. And why is this important? This is because at this time, there is no vaccine available for COVID-19, and there is still no reliable treatment. There are many trials underway of various drugs and combinations, such as hydroxychloroquine, IL-6 antagonists. There's remdesivir and other antivirals, and convalescent serum, so like an antibody treatment, but none of these have been proven to be unequivocally efficacious at this time. Okay, so how contagious is COVID-19 compared to other diseases? So on average, we think that a single person who has COVID-19 will infect 2 to 3 other people on average. Okay, so if you see over here on this chart, COVID-19, infects 2 to 3 other people, right? But if you look at a disease like measles, this is actually much more contagious than COVID-19. And on average, one person will spread their disease to 12 to 18 other people. COVID-19, though, is more contagious than influenza, which is the flu. And flu spreads on average, less than like a person with flu would spread it on average to less than 2 people. Okay, other ways in which seasonal flu and COVID-19 differ is that patients who have COVID-19 require hospitalization in about 1 in 5 cases, whereas for the flu, only about 2% of those patients actually end up needing hospitalization. Also, you are more likely to die if you have COVID-19, and you can see that the risk of dying is about 1 to 3% in some studies, whereas with the flu, with the seasonal flu, it's about 0.1% on average. Okay, so what can the public do to reduce the spread of COVID-19? Okay, so there are many things that the public can be doing at this time to help to reduce the number of cases that we're seeing in Texas as well as in other states. One of the very important things is that we should be washing our hands frequently with soap and water for at least 20 seconds, especially when we come back from public places. If we do not have soap and water readily available, we should be using a hand sanitizer, which has at least 60% alcohol, and ideally is one that is FDA approved. You're supposed to rub the hand sanitizer onto all surfaces of the hands and then keep rubbing until it completely dries. We should also avoid touching our eyes, our nose, and our mouth with unwashed hands. Okay, we should all be practicing social distancing as much as possible. And what does this exactly mean? This means we should ideally be staying home as much as possible, working from home as much as we can, avoiding gatherings of people and non-essential travel at this time. And then it's important to keep a distance from other people, ideally around 6 feet, as we talked about. And this is especially important for those people who are at higher risk of getting very sick from this disease. We should be covering our coughs or sneezes with a tissue and then throwing that tissue away in the trash, even if we're at home, and then washing our hands or using hand sanitizer. Other things that we should be doing around our home and in our workspaces, if we are going to work, is that we should be cleaning and disinfecting frequently touched objects and surfaces. And this is because there are some studies in which the virus, which was actually seen to survive for up to 8 hours on latex and aluminum, 24 hours on cardboard, 3 days on countertops, plastic and stainless steel, and up to 5 days on wood and glass. You can use, most EPA or Environmental Protection Agency registered household disinfectants will work. But if you don't have these, it's simple. You can just mix 1/3 of a cup of bleach in a gallon of water, and that will serve as your disinfectant. Okay, and then as we know, San Antonio Metro Health actually recommended wearing masks in public as the COVID-19 cases continued to rise. And this was instituted on April 6th. And so everybody at this point should really be wearing a cloth face mask whenever they go out in public, whether it's to the grocery store or to pick up other necessities. And remember that this cloth face mask is more so to protect other people from the germs that you might have if you were to have COVID-19, but you're not even having any symptoms. Because remember, it can still spread even if you don't feel sick. And another thing that I've seen people doing in the grocery stores is they do not maintain their distance from others. So just because you're wearing a mask doesn't mean it's a substitute for social distancing. So you still have to keep your distance from others. Okay, the other thing the public can do is to carefully watch for symptoms, right? So people who have been exposed to coronavirus can develop symptoms anywhere from 2 to 14 days after exposure, although on average, it is about 5 days. Okay, and then these are just the most common symptoms that are seen with COVID-19. So one of the most common symptoms is cough, which is usually a dry cough. That means that not a lot of phlegm is produced, not a lot of spit is produced. Another common symptom that is seen is fever. Less commonly, you can see shortness of breath, you can see a sore throat, feeling just tired or fatigued, headaches, body aches and pains, and then some patients will also develop diarrhea. Rarely, although it seems like it's more common in social media, you can have a stuffy nose or a runny nose, you can lose your sense of smell, and in some cases you can have like rashes and things like that, but those are relatively rare. So the unfortunate thing is that COVID-19 unfortunately has a lot of symptoms which are in common with other commonly occurring diseases like the common cold, as well as the flu, and then seasonal allergies. But there are some distinguishing features, and I didn't want to go through this in too much detail, but just, seasonal allergies, you would more likely have itchy eyes or an itchy nose. You're more likely to have sneezing with allergies as compared to with coronavirus. With the flu, you are more likely to have, in addition to the fevers, the tiredness, the headaches, and then the body aches. They are more common with the flu. And then with the cold, a major distinguishing feature is that it does not cause shortness of breath, and it can cause a fever, but typically it's a lower grade fever. So it's not as high of a fever as you would see with the other illnesses. Okay, so how severe is COVID-19? How worried should I be if I was to get this virus or be exposed to this virus? So the good thing is that at least 4/5 of the patients will have mild disease, or they actually may have no symptoms at all. 15% of patients who actually acquire the virus will have more severe disease and will actually need hospitalization. And then it's those 5% of patients who actually will become critically ill from the virus and can actually die from this disease and end up on the ventilators and in the ICUs. Okay, those who are 65 or older or have medical issues such as heart disease, diabetes, cancer, or otherwise have a weakened immune system, they are at higher risk for getting very sick from COVID-19. So this disease can go rapidly from an upper respiratory infection where your nose and your throat are affected and you have like a dry cough. It can go to a pneumonia, in which case your lungs actually become infected with the virus. And then it can progress in some cases to acute respiratory distress syndrome, or ARDS, in which the lungs fill up with fluid. And this can result in shock, which means that your body is starved of oxygen. So the organs are starved of oxygen. And this is actually the main cause of death from this virus. In other individuals, although they may recover from the disease, if their lungs are involved, they can develop something known as pulmonary fibrosis, which means scarring of the lungs. And this can affect the function of the lungs later on. Okay, so how should you decide if you need to be tested or seek care? Not everyone needs to be tested for COVID-19. If you think you may be sick, you should stay at home and consult with your physician about the need for testing. The CDC does have guidance for who should be tested, but decisions about testing depend on your state and local health department and/or the decisions of individual clinicians, because it depends on what testing facilities you have available, what is the current situation in your state. Most people, as we said, will have mild illness and they can actually recover at home without need for more advanced medical care. They may not need to be tested. They can take Tylenol as needed at home, just monitor their symptoms. And if their symptoms worsen, then they need to seek medical attention. But the people who we talked about who are at higher risk for getting very sick from COVID-19, such as the elderly, people with medical issues like heart disease, diabetes, cancer, or a weakened immune system, if they have symptoms and they're worried about having COVID-19, they should call their provider and they do likely need to be tested. If you need help finding a doctor or accessing medical care in Texas, you can call 211 and you can be directed to a low or no cost provider in your area. And even if you don't have medical insurance, you can still get tested if this is needed. Okay, so if you go to the Department of State Health Services website, you can actually put in your zip code and search, and you can pull up the closest testing site to you. Most of the tests which are performed are nasopharyngeal swabs, and in some places they perform oropharyngeal swab. And what that basically means is they have a stick which has a swab at the end of it, and they'll put that through your nose in your nostril, and they'll swish it around, go to the back of your nasal cavity, and get the sample that way. Serology testing, which is basically a blood test, is also available. But this test is more so to look for people who have already had the disease. It's not as useful for determining if you currently have coronavirus. There also is a saliva-based test, which was recently approved by the FDA, but this one is going to, needs validation, and it's going to take some time before it can be reached out to the public. Okay, so what should you do if someone else in your home is sick? So what if you have a family member who is ill? Okay, so that ill person should ideally be kept in a separate room from others in the household. This is very important to help prevent the disease from spreading to others. And this includes having your own separate bathroom, if possible, having, separate utensils. Ideally, the food should be put at the door of so you should ideally be getting bed and breakfast and getting treatment in your, room. If the patient does have to come outside at any time, they should ideally be wearing a mask. Surfaces need to be cleaned frequently. And whoever is actually taking care of a sick household member should also follow recommended precautions for cleaning and social distancing and maintaining a distance from the sick person as much as possible, and then also monitoring their own health. And this is a very common thing, right? So that one person will get infected in the household, and then, you may infect another person, and then it spreads in this way. And even if a person has no symptoms, they can still spread the disease to others. Okay, so what's the difference between isolation and quarantine? So isolation is the term used for when you are sick. And this is basically what is used to separate those people who are sick with a contagious disease from people who are not sick. And it's recommended you stay in isolation away from others for at least 7 days after your symptoms started, and for at least 3 days until your symptoms have improved in terms of your coughing and your fevers. Quarantine is different. So quarantine actually separates those people who are not sick, but they have been exposed, or at least they have been at risk for being exposed to somebody who is sick with an infectious disease, like in this case, COVID-19. And in this case, it's recommended to be in quarantine for 14 days, because 14 days is the upper limit of when you can actually develop symptoms. Okay, but what if you're at home and you're, isolating yourself from others and your symptoms get worse? So anytime you develop emergency warning signs of COVID-19, you should seek immediate medical attention by dialing 911 or by going to the emergency department, or whatever means you have available. Now, these emergency warning signs could include difficulty with breathing or shortness of breath, persistent pain or pressure in the chest. And both of these basically signify that you are developing a pneumonia, right? So the infection is spreading to your lung. Other symptoms include new confusion or inability to arouse a person, as well as bluish lips or face. And both of these symptoms basically mean that a person is not getting enough oxygen to their organs. Okay, so moving on to the last part of the talk, so some frequently asked questions. Okay, so does the coronavirus affect older people, or are younger people also susceptible to the disease? So we do know that people of all ages can be infected by SARS-CoV-2. Okay, and you can see that over here. This is just the cases in Texas alone. And you can see that, there have been cases which have occurred all the way from children all the way to above 75-year-olds. The most number of cases, though, have been in those who are between 20 to about 69 years of age. But you can see the risk of dying is much higher the older you get. So especially in those who are over 80, you can see most of the deaths actually occurred in the elderly. Okay, the second frequently asked question or myth is that, will COVID-19 go away with warm weather? So you can actually catch COVID-19 no matter how sunny or hot it is or how cold it is. So countries with all types of weather have reported COVID-19. There are some diseases we know which spread more easily in cold weather, such as the flu, but that doesn't mean it's impossible to get it at other times of the year. And we know that exposing yourself to the sun or to temperatures higher than 25 degrees Celsius does not prevent the disease from occurring. Okay, this is also a very commonly asked question. Can you catch coronavirus from food? Okay, so I would say, although the risk is very low, it still is there, okay? Because, it is, after all, it's the majority of the spread occurs by droplets, like we said, from one person to another. But, is there a possibility that if somebody sneezed on your food, you could touch it and then, put it in your eye or your nose? And it is a possibility. And so, I think it's reasonable to follow, within reason, some precautions in terms of just careful washing of your groceries. When you go to the grocery store, make sure when you come back or even in the car, just wash your hands carefully, use hand sanitizer, and just follow, basic common sense precautions. Okay, can spraying alcohol or chlorine all over your body kill coronavirus? So no, spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. In fact, this can actually be harmful. And therefore, I would also advise that please don't share, unverified facts or recommendations to others on social media, because then some people might actually apply it and they might harm themselves from doing this. You should always check your sources. Ideally, if you do want to share information that's published on the CDC or by the WHO or other, reputable sites. Okay, are there any specific medicines which we could take to treat coronavirus or to prevent it? So to date, there is actually no specific medication which is proven to be effective for prevention or treatment, as we talked about. But supportive care especially becomes very important in those cases which are more severe, like we talked about, and they would benefit from hospitalization. Okay, and then lastly, do vaccines against pneumonia prevent you from getting coronavirus, or vaccines for the, against the flu? So we do not believe that is the case. So vaccines against pneumonia and the flu do not provide protection against COVID-19. Trials have already begun. But the reality is, in order to have an effective vaccine, it's at least 12 to 18 months away. And we don't know what the effectiveness of this vaccine would be, even if it does become available. Okay, and then lastly, I think I can't possibly cover everything that the public does need to know, but the CDC has a wealth of information for all groups. So for healthcare professionals, for COVID-19 and funerals, for children, those who have special healthcare needs. So I would urge you to go to the website for the CDC if you would like to get more information on this topic. Okay, and then going back to our situation in Texas, so we know that, since this social distancing, was put into place, in terms of housing assistance, calls to the city of San Antonio have gone up from 47 to about 5,300 per week. 71,000 people in San Antonio alone have filed for unemployment over the last month or so. And by some models, Texas states that there has been a decrease in the peak of the deaths that were occurring. So, economy versus health is a very delicate balance. And, I guess the governor, Greg Abbott, he actually on last week recommended and actually issued an executive order in which he recommended to start a slow reopening of Texas, right? So as we know, the Texas state parks, they reopened last week, and then retail stores were supposed to open yesterday. But we have to remember that as these restrictions are eased, it is very likely that we're going to see new waves of infection over the coming months. Okay, and then you all know this from the news, but in addition to Texas, There are other states which have also recommended a stage-wise, a stepwise reopening of businesses. And this includes South Carolina, Georgia, Oklahoma, Colorado, as well as other states. Okay, so in summary, all 50 states at this point have reported cases of COVID-19. The cases in Texas and for us locally in Bexar County, these are still being diagnosed on a daily basis, and we have not yet had a consistent decline in the number of daily cases. These cases not only include imported cases from travelers, but also cases which are contacts contacts of known cases, but also community spread in which we don't even know the source. With the easing of restrictions over the next few weeks to months, it's expected there will be future waves of COVID-19 infections occurring for the next several months or even years. Everyone can play an important role by practicing social distancing, using a cloth mask in public, staying at home as much as possible, avoiding unnecessary travel, washing their hands, cleaning frequently used surfaces, self-quarantining, and then seeking help if there is concern for infection. Following these measures will allow us to slow the spread of this disease and will allow our healthcare systems to effectively take care of those patients who require hospitalization. Okay, and with that, I would just like to make dua for all those who are suffering not only from this disease, COVID-19, but also from other illnesses and hardships which we have to face. And with that, I'd like to open it up for any questions.
Okay, I would like to thank everyone who joined, and thank you, Dr. Kizilbash, for taking time out of your busy day and providing us with expert insight and answering. We'll wait for a few seconds if anyone has any questions.
I have a question. This is Nadeem. Sorry, I joined late a little bit, but so regarding groceries and cart boxes, you know how we go to the grocery store and sometimes these are boxed groceries, perhaps, and then some of them are, vegetables and whatnot. What is the lifespan as far as the virus goes, and how let's say I ordered a monitor the other day. It's a for my computer. About how long does the virus stay? Like my wife is pretty, she's pretty strict about this, and she sort of quarantined the box in the garage for like a few days, and I'm like, I think it's been there for 3 days. It's safe enough for me to get it now.
Again, the likelihood is very low. Okay, but do you really want to take that risk, right? So even if there's a tiny risk, say it's like a 1% risk or a low risk, it's okay. On cardboard, like I said, the virus can survive for up to 24 hours. So even if you leave it out in the garage for a day, you're fine. And even if you didn't leave it out in the garage, I think the risk is still very low for transmission. But if you want to be extra safe, put your mind at rest, I think it's okay to do that, in this time.
Okay. Now, regarding you just talked about it briefly at the end, where a lot of these governors are opening up the economy, in their states. I work at USA, and there's some talks that they may be opening it up too. And obviously, you cannot do the social distance thing simply because of the amount of spaces available. What are your thoughts on that? Is this the right decision, or are they
so as I said, it's just a balance that we have to make for economy versus health. Now, it's foolish, I think, to say that, okay, there are not going to be any more cases, because there are cases which are occurring on a daily basis. As I showed, Texas has over 800 cases every single day, even right now.
Right,
So
right.
I mean, and it's only expected, right, that if you ease these measures, the number of cases are going to go up.
Sure.
But what we can do on an individual basis is just still practice these measures, like for those who can work from home as much as possible, try to do it, and still practice those measures, right? So if you're in a public space, wear your mask. I don't think they're going to ease the restriction on the mask anytime soon. And that makes sense to me.
Right.
If it's used properly. And then just avoid large gatherings, wash your hands. I mean, there definitely, I mean, in my opinion, at least, I think the number of cases will go up when they ease the restrictions. But you have to draw a line somewhere, right? It's just a balance.
Right. Exactly. So you don't recommend what President Trump is suggesting in just taking the RV lights or whatever he was talking about the other day, all the disinfected sprays, and I don't know if you've heard of it or not in the news.
Or
recently.
injecting
Or
the
injecting.
disinfectant?
Right.
No, definitely not. That wouldn't be a good idea.
Yeah, I know, that was a joke. Well, I appreciate your answering the questions, and thank you so much for what you all do. I mean, I know you guys are on the front line and most at risk for this specific virus. So thank you so much. Appreciate it.
Okay. Thank you very much for listening.
All right, so any other questions? Seems like for the most part, and we keep hearing this question about the groceries, especially, and like you answered it, I mean, just to ease our minds, it's recommended. Go ahead and wipe off the surfaces, wash it as much as you can, and takeout is another big thing.
Yeah, so again, the risk is, even with takeout, the risk is very low, right? That you're going to put it on a surface and then so, I mean, but again, if you want to be careful, if you're getting takeout, maybe just keep alcohol wipes in your car and you could just wipe it down, even in the car. Or when you get home, you could take it out of the plastic. And then wipe it down. I mean, these are, again, the risk is very, very low. Chances are if you eat out, you're more likely to get diarrhea and food poisoning rather than COVID-19.
Yeah.
But if it puts your mind at ease, why not, right?
I believe there was an article just a couple of days ago that says that you don't have to wash your groceries or even take out. I think I read that.
I exactly. And there's going to be different things flying around, right? So I think the risk is very low. Again, the risk is higher that you'll have some other food poisoning from your takeout food than COVID-19.
Right. Cool.
Okay, so I would like to end this session with a small prayer that may Allah help us become better human beings and try and listen to our prayers in eradicating this pandemic and keep us all safe. Thanks again, everyone. And thank you, Dr. Kizilbash.
Thank you very much. Thank you for inviting me.
Take care. Thanks.